Well, since the pandemic, we've heard about the troubling state of mental health in young people. So what is the state of youth in Canada? We welcome psychologists Tanya Johnson and Tammy Shamoun. Good morning, ladies. Hope you had a fabulous long weekend.
Thank you.
Good. Okay, so Tanya, we'll start with you. What are we seeing in the data about how our kids are doing?
So it's estimated that about 1.6 million children across Canada are struggling with mental health issues at the moment, with anxiety, depression, and ADHD being the most commonly diagnosed disorders. What we're seeing on the ground at the Institute is that many families are telling us that their kids are having a hard time with feeling as if they have deep, connected relationships with others and with really knowing who they are in the world. Unfortunately, many of our children are waiting months and months and months to access any form of mental health treatment. And if they do go privately and don't have insurance, it can be expensive. So what's worrying about this is that we know that early intervention is absolutely critical. The earlier we intervene with kids, the better the long-term outcomes.
And really quickly, what are you attributing some of these mental health issues to?
Yeah, well, I think since the pandemic, we've really seen a steep decline in mental health. And I think a lot of it comes down to excess cell phone use, to our children not having deep passions, to not knowing how to interact with one another, to not getting outside. So I think that there's a whole host of issues. I think our children are really missing out on those wellness factors.
Very troubling. Okay, Tammy, what are some red flags to know if your child is struggling?
Well, I could list a long list for you. Unfortunately, when we think of like a child, every child's really unique, right? So we have to think like parents need to follow their gut, and they really need to think like who their child is and all of a sudden where they step out of that. So usually we're going to see it around lack of participation in their life, sleep issues, eating issues, isolation. So where they used to find joy, where they used to find connection, they no longer find that anymore. And with our littles, we think of really regressive behavior where, like they act younger than they were. Like taken back to an earlier stage of development is quite key. And it's really normal for kids to show irritability versus just sadness. Like we see, especially our young ones, that's where we'll see that. Lots of tantrums, lots of crying, lots of outbursts. And then our teens, of course, can get socially withdrawn, or they seem to be when they hide in their room. That's normal. But it's when they stop participating in their life that we start to worry. Things that they normally find joy in, extracurriculars and friendships, when they stop participating in that part of their life, we start to sit up and pay attention.
So what can parents do?
Yeah, I think so often when things feel fragile at home, I think we worry about the perfect thing to say or do with our kids. But we want parents to know that there is no perfect parenting script or parenting tool. It's who you are to your child in those moments. They just need you. So be present, slow down, talk a little bit less, listen to them deeply, and become curious about what's really going on for them. We find one of the best places to talk to children is actually in the car because it's not nearly as confrontational. We don't have that direct eye-to-eye contact.
Good tip,
Yeah, the other thing that we often say is that when we focus in on a child's wellness, they sometimes retreat a little bit because they feel as if they're under the microscope. So if you're feeling like that's happening in your home, focus instead on the family's wellness. So ask yourself, should we put our phones down a little bit more? How do we move our bodies a little bit more? How do we prioritize sleep? Often those small changes within family units create a cascade of wellness.
Unfortunately, we run out of time, but Tammy, can you really quickly talk about accessing services?
Yeah, I would say the Institute of Child Psychology has courses for parents on mental health, so they know what to do at home. I would say go to Psychology Today and look for a therapist that is trained in appropriate modalities such as play therapy, art therapy, animal-assisted therapy are great. And if you can't afford services and there's a wait list at CASA or Alberta Mental Health, call a private mental health clinic and ask to see a student, an intern. They offer very low rates. They're in their master's degree at City University or at the BASCA or U of A, and they can see children at a much more subsidized rate to make it affordable.
Thank you for squeezing that in, ladies. Thank you so much. Tanya and Tammy are the authors of the Parenting Handbook, and you can find more at the instituteofchildpsychology.com.